Hey everyone. Apparently, not everyone was well trained or received any training, unfortunately, on our preoperative form. I just found out, so I wanted to give a quick video so that people can either refer to it or learn the first time. Should be pretty self-explanatory since most of us know about Power Notes. I just wanted to show you what we're going to be doing with our Go Live is using electronic form or electronic version of our anesthesia questionnaire. So just like anything, when we open our patient's name, we go to documentation. Usually our favorites pops up. That's what's dithered. In this case, when you grab a new note, you're going to go to ANES. If you're creating a new note, and we're going to scroll down to find FMC anesthesia pre-op note. Make sure you choose the FMC version, not the VVMC version, or just the standard anesthesia pre-op note. Because that's the one that's tailored for us. You're going to click OK. It's going to open that note. This basically, just think of this as an electronic version of our current anesthesia questionnaire. Okay, it's fashioned very much the same way. Anything in yellow that you see here is a required field before you can sign and submit. You can save a note without doing the required stuff, but anytime you sign or submit, it has to be all the yellow stuff has to be filled out. So most of these things are going to be filled out by a preoperative nurse in the clinic or in pre-op itself. Those nurses will fill out a form which will pre-populate and they'll ask these questions, and they'll try to fill out as much as they can. Again, very similar to our existing procedure. So when a patient goes to pre-op clinic, they're filling out the green sheet. Consider this the green sheet. So all this is going to be filled out, surgeon scheduled. Obviously, if you're seeing the patient the first time, you're going to be filling this out. Plan procedure, all this. Basically, anytime you have a required information, you can just include one thing that will fulfill the requirement that yellow field is complete. You can be as detailed as you want or not. Family history, include on, you see it opens up different fields. If you, just like most things in PowerNote, if you want to click on it twice, it gives you a negative. So on your pre-op form, it'll list negative family history if it's got the red line through it. And to get rid of it, you just cycle through those again. So these things are pretty self-explanatory as you go through the list. One thing that is required is a user problem list, which should be pre-populated. If you click on it, the population or the problem list should be entered by previous visits or current visit that a nurse or another physician has entered. You can either mark that you reviewed it, or you can include everything that's listed into your note, and you'll see those things populated right into our note. So you don't have to write everything down, like hypertension, diabetes, all that thing. Histories, if the patient's coming directly from the ER obtunded or they're intubated, you can just click that trauma patient history unattainable secondary patient condition. Past medical history may be listed separately. Again, these are different than active problem lists. These are past medical histories. You can, again, include it right in your note. Procedural history, same thing. Anything that's already populated in their patient chart, you can include. Also, if you want to add something, doctor, I forgot to tell you, I had a tonsillectomy when I was 6. You can click Add, punch it in, and then you can include, and those will be listed. Review systems, again, you can be as detailed or not as you want to be on these. These are really similar to all the boxes on the front and back of our current questionnaire, where you can list the entire review of systems just like a regular H&P would have. And some things to point out. Under cardiovascular, you can list what type of stents they had, if it was bare metal or drug-eluting, and you can type in when the date of that drug-eluting stent was placed. The other things that you can put on here, there's some other drop boxes like type of hepatitis, and you can see type A, B, C. If it's anything other than that, you can click on other. If anything's minimized, you can show structure, and it expands that whole thing, just like our current Power Notes that people are familiar with. In fact, I'm gonna go back up and open that. And scroll down here. At the end of the review systems, the pre-op nurse or a provider that may go up and see a patient the night before will fill up to this point, the review systems, and then we'll sign here. At that point, once you get to physical examination is really for the day of surgery, just like what we currently do. That provider, either the nurse anesthetist or the doc the night before surgery, or the pre-op clinic 3 weeks before the surgery, will fill up to this point, sign here that they've taken the history, and then they're going to save and close. Very important that you don't try to sign and submit, and even if you did, it wouldn't let you do it because you haven't filled out all of the required fields at the bottom. So you're going to save and close, click OK, and that's going to save in the patient's chart. So now, 3 weeks later, when you come back as a physician or a CRNA ready to do the case, you're going to open the note. Really, it needs to be the physician that signs this note. Certainly the CRNA the day of surgery can add to the note, but because CMS requires that the plan is prescribed by a physician who's medically directing, it has to be signed by a physician the day of surgery. So the floor walker in this case would do it. What you're going to do is you're going to go to surgical reports under reports and docs, anesthesia records, similar to what we're always used to saying. I need to refresh this note. Here's our note. And so we're going to click on that, open our note, and then once you're in the note, you have to modify it. So you're going to right click a list of actions comes up, and you're going to click on modify, and that's going to bring up the same note. So you can see everything that was entered 3 weeks ago is listed, just like we're seeing the green form coming from the pre-op clinic. You can change anything you want that was previously entered. Say if their history has changed, they got a cold, they've had another procedure that they forgot to mention, things like that can all be entered. And really, what you're going to go do down is to the meat of the note, which is really down here on the physical examination. So you can pull in vital signs from their chart. So if they have a set of vital signs in the pre-op area, you can pull those right in. We don't have any vital signs on this patient because it's a fake patient. Of course, they're obese because that's what most of our patients are, existing here, we present. And then you're just going to continue to scroll through all this. Try to bring this up, sorry. So as you scroll down, you'll see required fields plan. That has to be, sorry, computer's giving me heck today. The plan has to be filled out. And so you'll see beta blocker, this is for tracking use. If they're on a beta blocker, you can list what type, you can list their dose, last dose type. If you do hold it, you got reasons why. And this is important. This is where the attending needs to mark what their plan is. Again, we only list one of these things. That's all we bill on is what type of anesthesia. So if you're doing a general, even if you're doing a general with a post-op block, you don't mark general and regional. You just mark general. If you're just doing regional without any sedation, you would just mark regional. Okay. And then the ASA classification, obviously important. And then here's where it's required. You, as a directing physician, or if you're a solo physician, are going to mark here. At that point, you can either enter NPO status if you so choose. Also, you can directly input orders from your power orders node, and it'll just open up our regular order set. Only if you choose. You can go back to orders if you want. You don't have to go from there. It's just for convenience. At this point, there's no tabs down here to sign anything. You notice on this form, it's up here, where you can go to your you can actually go to your task and sign, or actually documentation and sign there. So right now we were going to sign and submit, and then the note is complete. If you look here, we'll refresh. There's our completed note that we just finished. You can see it. I'm going to send out one other video that shows you how to grab a note and copy it. Say if a patient is coming back for multiple procedures, the same visit, or even for different visits, say like in ECTs. So that way you don't have to recreate everything, you can just update it. Thanks, guys.